Hey guys, so this video here is actually a requested video from my Instagram. So if you're interested in following me, it's just the same Midwifery Mothers on Instagram. I post updates on when I've got new videos as well as little quotes and things that I find. So if you're interested in following, just click the link below and be sure to leave a request because it will get me. So essentially this woman is starting midwifery and she has asked about the highs and lows in midwifery, of which there are plenty. So I'm thinking I'm going to start with the lows so we can end on a positive note. So I'm just going to go through a few things that we experienced to give you a bit of a picture of what it might be like to study midwifery. So I think one of the most prevalent lows in midwifery, which is a very obvious thing, is infant loss, miscarriage, that sad side of midwifery, because midwifery is generally a happy time. So when things go wrong, it can be quite devastating and very confronting as a healthcare professional. As a student, I haven't really been so much exposed to a lot of that, but I have certainly come across it. And it's something that can be very personal and you have to kind of debrief with and talk to your mentors about. But I would say 90% of midwifery is positive. So even though you are dealing with those lows, there are definitely a lot of highs. Another thing that's a bit of a low in midwifery is that in Australia, as a midwifery student, if you go direct entry and aren't a nurse first, you don't get paid, and working sometimes 40 or more hours a week and not getting paid is really hard. I'm super fortunate that my parents are supporting me through this degree, but I definitely think it can be hard for people who are in a bit of a financially tight situation. So it's something to consider if you're going to go into midwifery. Midwifery, being in the hospital and also at university, there is a high academic demand. A lot of people think maybe going into midwifery that it's going to be caring for women and birth, and yes, whilst that's a massive aspect, another huge aspect is writing several 2,000-word essays and reading journal articles. And that can be a little bit difficult, especially say if you're a mum going into midwifery and haven't written an essay in years. The academic demand can be hard, but I definitely think the university has resources available to help you through that. As midwives, we are taught a lot about a natural birth, how it is a normal process. These are women, not patients, and kind of when everything goes right situation. But when you get into the hospitals, it can be a very different thing and it can be very upsetting. I think there is a lot of obstetric intervention, and whilst I thoroughly believe there is a place for obstetricians, sometimes I think the interventions can be quite confronting and unnecessary, and that can be very frustrating because it's not necessarily the midwifery you signed up for to deal with these normal healthy women. So that's definitely something I find that gets me low, especially for women's being in a long labor and then it's just been intervention, because they get quite traumatized by it as well. Another thing as a student is you're burning the candle at both ends. You're trying to keep up a part-time job maybe to have some money. You are studying at university, you are doing placement, you are on call sometimes, and sometimes you can burn out. So for me, it is a lot about self-care, but a lot of times I have questioned if I can do this just because the mental demand is so high. The hardest thing for me in midwifery, the biggest low, and something that I just experienced again just this week, is bullying by midwives. It's pretty much 99% female workplace. There can be a lot of bitching, a lot of fighting, and there can be a lot of impatient midwives that do bully you. And I think for me, I have been constantly bullied. Sometimes it's little things and sometimes it's big things, but I've never recognized it as bullying until my 3rd year, and now I've realized, hang on, you can't treat someone like that. So I'm thinking of doing a separate video on bullying. If you're interested in that, just let me know. But this is definitely something as a midwifery student that you will experience, unfortunately. So now onto a much more positive note, and something I much rather talk about is the highs of midwifery. So the biggest high, and what gets me emotional almost every time, is that you are there at the happiest moment of a woman and their partner's life and their family. It's such a privilege to see people filled with such oxytocin, such love. It's incredible. You know they will remember this day forever, and being part of that is such a privilege. So that's what keeps me going, honestly, is those moments. I just had a birth last week where the mum just cried and told her baby how much she loved her, and I was crying. I had to leave the room. I was like, oh. So those moments are what keep me in it, and they are so special. So another massive high is the satisfaction you get from being able to help someone. I have this quote that is, "The purpose of life is not to be happy, it is to be useful, to be honourable, to be compassionate, to have it make some difference that you lived and lived well. For me, it's so satisfying, yeah, being able to know that you've made a difference in someone's life, and that is a massive privilege and an awesome part of being a midwifery student. Another massive high is realizing how quick you change, grow, learn and mature. It is crazy how rapid it is. Sometimes I'll be like, last year I was like a complete novice and now I feel so confident and secure. So seeing that rapid improvement is super satisfying. I think personal growth just feels incredible. It's what we're meant to do, and you certainly see it as a midwifery student. For me, being young, knowing that I'm gonna have my career in a year's time, having done 3 years of study, is awesome. I think it's so nice being young and going into such a secure job. Being a midwifery student gives you such massive life skills. It helps you relate to people. It gives you a conversation skill. You'll be at the shops, you say you're a midwife. Watch how many people will tell you their birth story. I love to hear it, and I always try and put a positive spin on it because I think sometimes you can hear really bad ones. For me, in my first year, there was actually this woman in the shopping centre who had collapsed. She was having like cluster headaches. I was able to use my skills that I use with women in labour to help relax her. So at the start, she was screaming, thrashing around. She was in so much pain and so scared. But I got her lying on the ground, breathing through her pain, and it was incredible to realize that because I'd studied midwifery, I was able to make a difference in some random person's life, which is awesome. So thanks for watching. I hope this gave you a bit more of an insight onto what it's like to study midwifery. I definitely want to make some videos coming off this and expanding on some of those ideas. So if you're interested in any of these ideas being expanded, just let me know. Any suggestions I will make. I really love giving the knowledge I have to new students because I remember exactly what it was like. So thanks for watching, and I'll see you next time.